I'm honored to be here with several members who are, also members of the General Assembly, some of my colleagues in the House of Delegates. Delegate Ryan Spiegel is here, Delegate Chris Fair, Delegate Caitlin Young, as well as Delegate Rim. So we're a mixture of Baltimore City, Montgomery County, and Frederick County. And thank you for joining us this morning. What we have seen in the news recently is that President Trump has signed an executive order for the U.S. Attorney General to review gun-related policies impacting the Second Amendment. And that includes gun violence prevention and intervention work. So despite gun violence going down because of the resources into gun violence intervention and prevention, despite the work that's working towards making communities safer, resources at the federal level are under threat. So as we enter an era of increased uncertainty in federal funding, creating dedicated revenue streams for gun violence prevention, intervention programs, and the like have never been more important. The trauma of gun violence is not an anomaly. It's far too commonplace, which means we need a common sense and comprehensive solution. HB 387, the Comprehensive Community Safety Funding Act, targets industry profits, not consumers, with the goal of strengthening and supporting families and communities most impacted by gun violence. It establishes an 11% excise tax on the gross receipts of a federally licensed firearm dealer derived from the sales of firearms in Maryland. This excise tax is further extended to out-of-state firearm retailers who have either generated over $100,000 in revenue selling to Marylanders or have completed at least 200 transactions in the state of Maryland. Now, the original bill has been amended to disperse the funds the following way. A portion of the money, about 20%, will go to the Coordinated Community Supports Fund under the blueprint to address youth behavioral health. 4% each will go to Maryland's Trauma Physician Fund, as well as the R. Adams Shock Trauma Fund. 20% will go to survivors and homicide victims, and 26% will go to the violence prevention programs, both under the Governor's Office of Crime Prevention and Policy. 26% will go to the Center of Firearm Violence Prevention, which is a new agency developed from the bill last year. So I want you to take the time to hear from those that are going to be benefiting from this piece of legislation. They're the ones closest to the ground, closest to the solutions. So I am proud to introduce next to discuss youth behavioral health, Layla Breton, who is the founder and president of Teen Enough in Baltimore.
Good morning. My name is Layla Breton, and I'm a founding member of Teen Enough Baltimore, a youth-led arm of the Brady campaign to prevent gun violence. I started this chapter to organize in my community because I wanted to create meaningful change by joining the fight against gun violence. It is vital that we include young people in these conversations, as gun violence is currently the leading cause of death for my generation. Watching the schools, malls, and other pillars of my community around me turn into areas where violence is normalized fills me with fear. I am fighting for change today, not only for myself, but for all students, all children. I can no longer sit by and watch as more lives are lost, and that is why I am here today. I'm grateful to speak today in support of the Comprehensive Community Safety Funding Act, sponsored by Delegate Mireku-North, which will support programs addressing different facets of gun violence and promote equal access to safety for all Maryland youth. Specifically, this act will create an excise tax on the sale of firearms throughout the state. That money will provide resources for the Coordinated Community Supports Partnership Fund, established under the Education article, which will enable schools to deliver multi-tiered systems of support and services to young people across the state. This fund aids the schools in combating the rising mental health crisis among teens. I believe it is incredibly important for there to be adequate funding going into serving the youth who struggle with these issues. Mental health continues to be a pressing issue among my generation, and it is our responsibility to create strategies that schools can implement as early intervention frameworks. The Coordinated Community Supports Partnership Fund would enable the schools in creating safe environments, expanding social-emotional learning, and improving access to behavioral health services, which collectively will address this mental health concern. My generation is experiencing a crisis across the country and the state. On average, 67 children and teens die by guns every year in Maryland. 17% of these deaths are suicides, and 82% are homicides. Guns take more lives than anything else. We can no longer watch as my peers across the state lose their lives to something so incredibly preventable. To be clear, The tax created by this law is an industry tax impacting firearm dealers and manufacturers, and it generates funds to support programs directly related to mitigating the harms which could not be caused without the industry's products. It is only fair that the industry that enables these cycles of violence bears the responsibility of mitigating them. The funding from this bill will provide a path to health and security that my peers and I desperately need. And that is why Team Enough unequivocally supports this bill, which will secure a safer future for my generation. I'd like to now introduce Alyssa Sanders, everyone.
Thank you. Thank you for being here today, for focusing on a variety of critical issues. I'm going to talk a little bit about children's mental health. My name is Alyssa Sanders, and I'm the Advocacy Director at Every Mind, a nonprofit that has provided mental health services in Maryland for over 65 years. At Every Mind, we meet young people where they are, right in their schools. We operate in over 35 schools, 7 of which are supported by the Coordinated Community Supports Partnership Funds of what we're discussing today. These programs address anxiety, depression, and trauma, issues that affect 1 in 7 children nationally and are increasing sharply here in Maryland, according to the Youth Risk Behavior Survey. The statistics are sobering, but it's the stories that truly illustrate the impact. Take a middle schooler that a clinician of ours had to worked with, who lost a parent and was struggling to cope. With support from one of our clinicians, they learned to manage their grief and reconnected to the school and the activities that they loved. Or the high schooler whose anxiety kept them out of school. After receiving counseling, they improved their attendance and their grades and gained lifelong stress management skills. These are just a couple of the transformations we see when mental health services are available in schools. HB 387 will help to ensure Maryland students have the support they need to thrive. This isn't just about therapy. It's about strengthening families, empowering teachers, and creating healthier school communities. Investing in school-based mental health is investing in Maryland's future. Thank you for prioritizing the mental health of our youth and for supporting HB 387. Together, we can make sure every child in Maryland has the chance to succeed. And now I'm going to turn it over to Stephanie Mavronis, Director of the Mayor's Office of Neighborhood Safety and Engagement.
Good morning. I'm Stephanie Mavronis from Baltimore City Mayor's Office of Neighborhood Safety and Engagement, here to bring support on behalf of Mayor Scott and the entire administration for the Comprehensive Community Safety Funding Act. Baltimore and jurisdictions across Maryland have proven that sustained reductions in homicides and non-fatal shootings are possible when community partners, law enforcement, and government work together to intervene in and prevent violence in our communities. However, it is still not enough. Any life lost to violence is one too many, and while progress has been made thanks to a one-time injection of Federal American Rescue Plan Act funds, that money expires at the end of 2026. Through the Comprehensive Community Safety Funding Act's use of a firearm excise tax to support the state's Violence Intervention Prevention Program, also known as VIP, which helps fund Baltimore community violence intervention ecosystem, we have the opportunity to maintain the momentum we've built and secure the necessary funding to continue this work, not just for 2 or 3 years, but for the foreseeable future. It's common sense that those partially responsible for the proliferation of guns in our communities and those who profit from harm and destruction should bear at least some of the burden to fund the crucial life-saving work that have proven themselves effective in reducing violence. I want to sincerely thank the delegate, Marylanders to Prevent Gun Violence, Everytown, LifeBridge Health, Moms Demand Action, Every Mind, and everyone here gathered today for their partnership as we work collaboratively to make Maryland the national leader for violence prevention and intervention work. Thank you very much, and I'll now turn it over to Adam Rosenberg for LifeBridge Health Center for Hope.
Thank you, Stephanie, and thank you, delegates, for sponsoring this really, truly important bill at this very critical time. Good morning. My name is Adam Rosenberg. I'm the Vice President for Violence Intervention and Prevention at LifeBridge Health and the Executive Director of our Center for Hope program, a comprehensive response to all violence that LifeBridge Health serves. I, too, am in strong support of Maryland's Comprehensive Community Safety Funding Act, HB 387. Since the 1850s, our health system has been critical and concerned about the well-being of our community health, and gun violence, as the Surgeon General said last year, is a significant public health issue here. At LifeBridge Health, it's been really the honor of a lifetime to work with the city on our Safe Streets programs and our community violence programs there. And we've personally seen the transformative impact of a well-funded safety initiative, just as the ones that my colleague Stephanie Margonis just mentioned there. Our Safe Streets programs have led to 0 homicides. Let me reiterate that. 0 homicides over a 365-day period in 4 of our areas over the past year. Our own Sinai Hospital, which is a level 2 trauma center, has seen a 52% reduction in gunshot wound admissions. This is not just a statistic, but this represents real lives and families that were kept whole there. These successes show the power of investing in community safety now. We also run one of the few programs in the state which supports children who've been exposed to violence, helping them heal and thrive. However, our efforts are threatened by significant cuts to victims of crime funding both locally and nationally. The Federal Crime Victims Fund, which funds VOCA, the Victims of Crime Act, has been reduced by $700 million. This causes widespread concern among all organizations that provides critical services for. Over 100 organizations in Maryland get support from VOCA there. The uncertainty surrounding new leadership in Washington only exacerbates these concerns, as future funding directions remain unclear. One very clear area, however, is on the first day and the first hours of the new White House, where the very successful White House Office for Gun Violence Prevention was taken offline and that funding has ceased. That's funding that has supported and lifted up many of these initiatives for many years, successfully driving down homicide in Maryland and across the nation there. We have no expectation that the hundreds of millions formerly pushed out to gun deaths will be a funding priority for this new administration in Washington. Locally, the Crime Victims Act, as I said, funds over 100 Maryland agencies who respond to violence. And currently in the budget has a proposed cut of almost 20% there. It's about $11 million, with another $1 million being proposed cut for the VIF programs there. That's why this excise tax is so critical to be able to keep these programs afloat. Now is not the time to reverse costs there. With over 600 deaths annually in Maryland due to gun violence, both homicides, suicides, accidental deaths, now's the time to do something. And the Comprehensive Community Safety Funding Act addresses these challenges. This ensures the resources are directed to communities that need them the most. We can make a significant difference, and this is the right investment to make at the right time, and we, like Rich, help join in supporting HB 387 to help us build a safer and healthier future. With that, I turn to Natalie Ibrahim from Moms United Action. Thanks.
Good morning. My name is Natalie Ibrahim, and I am here today as a volunteer with the Maryland chapter of Moms United Action, and I'm a survivor of gun violence as well as a parent of a gun violence survivor. I want to thank Delegate Mireku-North for the invitation to speak in support of the Comprehensive Community Safety Funding Act today, and this is on behalf of survivors of gun violence. 3 years ago today, on February 13th, 2022, my 4-year-old son and I were both shot when a group of people gathered for a gun sale that ended in a shootout at a playground near our home in Howard County. This happened in broad daylight on Super Bowl Sunday. The emotional and physical pain is something I could speak about at length, but it is not only the emotional and physical toll that has come as a result of this shooting. It is also the financial cost the shooting has had on our family and the state of Maryland. To start off, there was the cost of the immediate police and EMT response to the scene, the cost of 2 ambulance transfers, the cost of my hours of treatment at shock trauma, my son's treatment at Hopkins Pediatric ER, including surgery to remove bullet fragments from his 4-year-old arm. We must also consider the expenses of the month-long police investigation, multiple arrests, and multiple court proceedings involving dozens of state employees of all ranks. All of this was paid for by the state and taxpayers. Finally, we face the long-term costs of trauma therapy for both my son and me, as well as medical follow-ups that are still ongoing. But my story provides only one small glimpse of the overall picture. Gun violence costs Maryland $10.5 billion annually, with nearly $384 million paid by taxpayers. Meanwhile, the gun industry rakes in profits of around $9 billion across the country each year, making money off the pain, suffering, and damage their products create. The Comprehensive Community Safety Funding Act will create a stable funding source for our state's much-needed violence prevention and survivor support programs. It is the least that can be done to help remediate and mitigate the harms that firearms too often cause in our Maryland communities. And one program I'd like to focus on in particular is the Survivors of Homicide Victims Grant Program. This is a state-run program that provides victim assistance, advocacy, and support to the surviving loved ones of homicide victims. This program ensures that these survivors receive the services they need to achieve self-sufficiency, improve their safety, and are aware of their legal rights and the resources available to them. Healing from an instance of tragedy is not easy, physically, mentally, or financially, but it is programs like these that can provide life-changing support in a time of need. Our state's gun violence crisis touches so many families like mine. I'm so deeply grateful that my son and I are still alive today, but there are far too many Marylanders living with the pain of losing a loved one, taken too soon by someone who shouldn't have had such easy access to a gun. That trauma stays with those families for life, and we must do all we can to support programs that help survivors heal. Thank you for your time. Next, I'm going to turn it to Karen Herrerin, Executive Director of Maryland's to Prevent Gun Violence.
Good morning. I am Karen Herrin, the Executive Director of Marylanders to Prevent Gun Violence. Budgets are a reflection of our values, and right now, Maryland faces a choice. Do we invest in proven solutions to prevent gun violence, or do we allow instability in funding to limit our ability to act? While national politics drift further from Maryland's commitment to community safety, we must ensure that our state's investments reflect who we are. The Maryland Center for Firearm Violence Prevention and Intervention is a critical part of this effort. Housed within the Maryland Department of Health, the center is already in place, but it's new, and there is a great deal of work to do. For this center to fulfill its potential, it needs a reliable, long-term investment that allows it to grow into the hub that it is meant to be. The center will coordinate efforts across the state, strengthen community-based solutions, and ensure that resources are deployed where they are needed the most. It will help reduce duplication, direct funding efficiently, and collect data to guide evidence-based strategies. These are the kind of smart investments that not only will save lives, but will reduce costs over time. This legislation provides that investment by linking the cost of gun violence directly to its source, firearms. The financial burden of gun violence, from healthcare costs to law enforcement response to lost productivity, is borne by all of us. It is only fair that those purchasing firearms contribute to the solutions that help keep Maryland safe. While the revenue from this tax won't start flowing immediately, its passage would ensure that the center has the financial foundation it needs for long term. This is about sustainability. If we are serious about reducing gun violence, not just this year or next year, but for decades to come, we must commit to a funding stream that allows for real, lasting impact. Maryland has led the way on gun violence prevention before, and with this investment, we would be doing it again. This is about protecting lives, stabilizing communities, and ensuring that every Marylander, regardless of where they live, has the opportunity to thrive. Thank you. And I am introducing Christiana Interant from the Injury Prevention Coordinator at Johns Hopkins Trauma Center.
Good morning, everyone. My name is Christina. Thank you all for being here today. I am the Trauma Injury Prevention Coordinator and a member of the Break the Cycle team. Break the Cycle is a hospital violence intervention program that works alongside our trauma surgery team to reduce gun violence. Thank you for having me, and thank you to Delegate Mireku-North for introducing this bill. Maryland's trauma system is one of the best in the country. We function as a network of hospitals dedicated to ensuring patient safety, not only when an injury occurs, but working to prevent it before they happen. Sustaining that system requires more than just dedicated physicians and state-of-the-art equipment. It requires a comprehensive approach that includes staffing and delivering patient care through a trauma-informed lens. That is why the Maryland Trauma Physician Service Fund is key to addressing trauma injuries caused by gun violence, ensuring equitable distribution of resources across all trauma centers. This fund was created to offset the financial burden of maintaining 24/7 availability of world-class trauma teams, regardless of the patient's ability to pay. Johns Hopkins Health System operates 4 designated trauma centers, including the Johns Hopkins Hospital in East Baltimore. Collectively, we treat over 9,300 trauma patients annually, accounting for more than 1/3 of trauma cases in Maryland. Among them, 400 people, were treated for firearm-related injuries. At Johns Hopkins Break the Cycle, we witnessed the firsthand impact of not just the emergency room visit, but also in the lives of patients and their families long after they leave the hospital. Our efforts to prevent future violence, support patient recovery, and strengthen community partnerships depend fully on functioning trauma systems. This system must work in coordination with other stakeholders involved in this bill. Maryland's trauma system thrives because of strong partnerships, ensuring everybody works together to meet the needs of our communities. This bill reflects that commitment to improving lives across the state.
Thank you all. One thing I forgot to mention is the anticipated revenue for this legislation. It's about $15 million, fiscal year 2027, and it will go up over time, but that's the estimated amount. Because the bell rang and a whole of my colleagues are delegates with a very time-oriented speaker, I'll take one question, but we do have to part after that.
I'll be very quick.
Okay.
Yeah, I heard
Yeah,
you.
yes.
And she'll yell at you.
You don't want to get us in trouble.
You know how there's a few of these gun rights folks. So they come loud and they come allegedly proud, so to speak. And Mark Penny said last year that he thinks the bill last year, that it'd be easy to sue. Talk about the confidence you have in being able to get this passed, especially when during the budget crisis, and an administration in Washington that's a little different.
Right, well, you're talking about two things, the legality of it and whether it's going to pass given our budget situation, and I would say yes to both. I mean, I'm also a lawyer, and so I try to introduce anything without checking, crossing my T's and dotting my I's in terms of legality of it. It's based on the work that was done in California, which also created excise tax for guns, and it's also based on current federal law where there's an excise tax on guns to fund wildlife preservation efforts. So we definitely did our research to confirm that this would hold up in the court of law, but if they want to sue, so be it, that's their right to do so. Budget-wise, we're facing quite a bit of difficulty with our budget this upcoming year, and I think everything's on the table. We have so many of our colleagues that are putting in great pieces of legislation to try to generate revenue, and as a member of the Ways and Means Committee, I would be remiss if I didn't use all of my background experience as a former prosecutor, as a family member of a gun violence survivor, not to try to think outside the box as to how we're helping all facets of our Maryland government keep our community safer. And so I feel confident that we will work diligently in the House especially, and even the Senate, even though there's no Senate sponsor, to get this across the finish line. Thank you so much. We're going to run over the street. And thank you all to Moms and all the volunteers and advocates that came out today. Thank you so much.